how do you know it's anxiety or you are being paranoid? I think it's an excellent question. So how do you know that this is anxiety, or how do you know that this is paranoia? Hi, the Dream Weaver, how are you? So we're talking about anxiety, and I just want to talk about how do you know it's anxiety and how do you know it's not paranoia. Now, what is paranoia? Paranoia is out of touch of reality than the usual bounds. So I'll give you an example. Paranoia would be, oh, the world is going to end tomorrow. Now with COVID, I know we all thought that for a moment, but then it's not true. Anxiety is, what if I get COVID tomorrow? And that is realistic, right? So many of us have gotten COVID or are getting COVID, or our loved ones are getting COVID. So anxiety has some fundamental basis in truth. And for certain things, that kind of anxiety is actually even true. So don't think that anxiety is always baseless. Anxiety has a solid, rock solid base for most of us. Meaning, if my company is firing people, I may lose my job. That's not being paranoid, right? That's you being realistic. So you're going to possibly work harder. Being paranoid would be, my company fired one person in the last 3 years, and I am sure I'm going to be the next one, even though I did not do anything wrong. Now that isn't realistic. So we broadly describe, in the past, we used to consider mental health problems as, either they were into psychotic spectrum or they were in the nervous spectrum. Anxiety is on the nervous spectrum. So you do not lose touch with reality. There is some foundational basis in reality. Also, another thing, how do you know you're not being paranoid and you're being anxious is, if somebody tries to explain it to you, at least for some time you'll agree to it. I know that our anxiety sometimes becomes really big in our head and we start thinking, nahi, aisa hi hoga, jaise soch rahe waise hi ho jayega. But at least for some moments, you're likely to agree that, okay, maybe it's possible I'm not having a heart attack. Maybe it's possible that I will not get COVID. Whereas in paranoia, which is out of touch of reality, you will not be convinced no matter what. You will just disagree and say, my thought process is right, yours is wrong. So that is broadly describing about how to know whether this is you being anxious or you being paranoid.